found food and thought, oh, this is what we need to be
Oh,
healthy.
that.
Yeah,
Right on.
we need good food.
Yeah. So, and you had, I mean, you'd gone through the first pet food recall and just the insanity that was there. It,
Oh
and
yeah,
that
you
was
mean
before
back
you really
in
got into the food aspect of it. So how
yeah,
was
yeah, and
that?
back in when they had that, yeah, I remember, and it was very confusing when they had that issue, and but I think veterinarians just thought, okay, we just need a different kibble. You know what I mean? Like, there wasn't much introspection there, but
Really? Yeah. Yeah. So, so for me, during that whole event, the final blow to kibble and to prescription diets and all of that was the fact that at 5:30 p.m.
Mhm.
after the delivery truck for Hills had arrived, I got this fax, which tells you how long ago it was from Hills, that said, "Oh golly, we hate to say this, but we've had to withdraw. I forget which diet it was. It was probably the metabolic diet or something from the
Mhm.
market because we've realized there's a contaminant." And by that time, of course, all of their helplines were shut off. Everything was closed down, so there was no way to contact them. And it
Yeah.
was like, are you guys kidding me? That was
Oh yeah.
just ridiculous. And it was just, I was like, oh my God, you guys.
Yeah, and it was
So
yeah, it's just yeah, you don't feel like you've got, any support there for sure, and it is a scary endeavor when you but then when you start to think about even without the recalls worries, even the quality, and I'm sure you've done lots of investigation and research, and kinda we all had that eye-opening experience when we go, "Wait, they put what in the food?" You know? And then it's just like, this is not. And for me, at least, and I don't know if you had the same experience, but when I found food therapy as a discipline in traditional Chinese medicine and started to understand that you can use whole foods to benefit the body the same way, in the same way that we use herbs, in the same way that we use acupuncture, to try to direct the body to, naturally heal imbalances. Because honestly, we have to eat. We have to eat food, so we might as well eat some food that's gonna benefit our bodies rather than harm our bodies, right? So, I mean, for me at least, when I started doing those home cooking recipes, just as another arm of traditional Chinese medicine, the benefit that I saw was just, I thought, oh my gosh, this we need to feed our dogs differently if we're going to get the health that we want for them.
right on. And that's, I mean, that was the thing that was so powerful for me was that uh, my first experience with it was with one of my own dogs, and I was enrolled in the acupuncture course at Chi Institute at the time.
Yeah.
She had developed bacterial endocarditis, and literally, I watched on ultrasound as a lesion went from something like a centimeter on her heart valve and got stabilized. And we went through all the Western meds, took her with me to the Chi Institute at the next class. They told me the points to use, they told me the herbs to use, and they told me you really need to start cooking for her. And I'm thinking, oh, wow. Okay, I don't know about that. But, well, this dog was not having needles, period. So she
Yeah.
thought the herbs were okay, and she thought the cooked food was really an excellent idea. And so I
Yes.
literally watched over the next 3 months is that 1 centimeter, half an inch lesion shrank
Mhm.
to the width of a piece of paper. And there was no
With the herbs
question
and the
in my
food.
mind with the herbs
Yeah.
and the food. And that was it.
Yeah.
And
And
it's
it just
just that, yeah, there was no way that was going to happen with the conventional approach by itself.
right. We see a lot of, I'm sure you do too, is that's the patients that once the Western has, failed, and I say failed, there's a lot of great things Western medicine does, right? A lot. I mean, God bless antibiotics, and the Western therapies are real, and there are some true benefits there. But I like you, there's a lot of chronic diseases, and that Western medicine doesn't really benefit, especially when we're feeding a pro-inflammatory, high carb diet. That understanding the benefit of real food is kind of can be a real game changer. And what's so lovely, like you said, your dog enjoyed the food. Like, how wonderful that you have a treatment that they also happen to love, right? Like, how great is
Oh,
that?
yeah, exactly. It was like the highlight every day, twice a day. Woohoo! Real stuff. Cool. We finally
Yeah,
got
it
some
really
folks
feels good.
filtering in. Yeah, I mean, it's amazing. It's just, one of those wonderful things we can do. And so finally got the connection to groove together. And so we've got Lisa jumping in from Florida, Naja Mueller, who actually I got to meet at Feed Real event. And I think Naja is going to be joining us in the coaching program. And Dolores is jumping in from Long Island. So there's several of you. If you want to tell us where you're from, and if you've got questions for Dr. Bohr, just drop them in the comments here. We'll get to them as we go. But I mean, hey, Janet from Nebraska, but what you're saying is absolutely right. You start to see what food can do and the ability to really create essentially a prescription or follow an herbal formula that would benefit a specific condition using food is just an astonishingly powerful thing. So
Yeah. I always say there's nothing
yeah,
better
so
than you yourself. Like I love, like for our
yeah,
diets, we make them because not everybody can cook all the time, right? But
right,
my ideal is if we can do a little bit of, a whole food balanced diet, right? So check the box, we'll do the vitamins and minerals, and then have the dog owner or the client do a little cooking to add on, a little more prescriptive, a little more, if you want to alter things, rotate, get some nice healthy rotation in there. That can be great. And it's really wonderful to be able to share with your dog, a little bit of food. Because I always say they love three things. They love you, walks, and food. So being
right
able to
on.
bring.
It's awesome. And that's a great point too, because some of the things that we would use in food as a sort of a prescription would be not really tasty in large chunks. So for instance,
Yes.
if we were going to add ginger in, we don't want to throw the whole root in because we're going to put the dog's mouth on fire, sadly.
Right. Yeah. A
So
little bit. Yeah. Like I love mushrooms. I'm sure you do too, for lots of damp draining, anti-cancer
right
properties.
on.
We can feed them a plate of mushrooms. It's just a little bit of mushroom every day, but just a little.
Yeah. Yeah, exactly. Because and that's it. I mean, so not sure who T2 is, but are there alternative seasonings that can be used? And that's exactly it. We're talking about using things like ginger or culinary herbs really to help improve the prescription of the food. So what would you like? Let's say well, let me back up 3 steps actually. What are some of the most common issues that you see folks asking you about in terms of when they're starting on your products?
Yeah, the big one, of course, is lots of dogs with GI problems, right? Because that's kind of the obvious one that we're looking to food. And also a lot of GI problems with our dogs when we're trying to help them. Sometimes the problem is, not eating well. And so that's a problem like today, right? Like I'm sure you know the old saying that when in doubt, support the earth, meaning when you've got an ill dog, make sure you're supporting the
Right on.
digestion, their earth, right? So it doesn't matter. It's not that it doesn't matter, but before you can even get to what their issue is, you've got to have their nutrition, right? Because if you're not eating today, it doesn't matter if we're giving the very best in chemotherapy or the very best, this prescription. If the dog isn't eating, we need to focus on that today. So a lot of times we deal with, poor appetite, or dogs who are worried are going to have about, the fear of going to the hospital again is there. So we deal with a lot of that. And then we also deal with a lot of chronic inflammation. So I know that my dog's eating okay, but, can we do anything to help this Cushing's, or can we do anything to help their skin? So those are kind of the
Right on.
big categories are chronic diseases that are sometimes managed well or poorly with Western medicine, but we're looking for better. And then the other big category is lots of GI problems. We got to get this dog to eat, so those are probably the big 2 that I think that Chinese medicine food therapy can do a huge improvement on, with just, I don't want to say a little bit of effort, but, you can, home cook and, a lot, I'm sure, and make a hobby of it. You can find easy ways to home cook, or you can just say, I'm going to order a balanced diet and not have to worry about it. But really bringing food into those, big categories of diseases can be game changing.
Right on. And, Dolores is asking about ginger and turmeric. And when I formulated the original Crock-Pot diet, those are 2 of the herbs that I would include because long term, they're going to offer some support to GI digestion, and also turmeric in specific is going to help reduce inflammation by resolving stagnation. And it's really interesting. We're having to back away from turmeric now because we're seeing so many dogs that are sensitive to it. So
Yeah,
we'll use
a little bit of
ginger or
more
some.
is, yeah, and a little bit of kind of being wise that, more isn't always better. Kind of like that you can't, you can do too many supplements, right? That same kind of idea is with some of the, spices to be just very small amount.
Right on, right on. And that's it. We're not going for therapeutic dosing here. We're going for long range support of all of the systems. So,
Absolutely.
and Dolores, you're also asking if it helps with bloat. And,
That's a good
the
question.
last research I saw with bloat was the dog eats the kibble, drinks a ton of water, and then that creates the issue. And
Yeah.
so I think real food, regardless of how you do it, helps because it's much easier for the dog to digest and get things through the system. So,
Right.
yeah, have you?
Absolutely. Yeah, I
Yeah,
would say question, does it help with bloat? Absolutely. You just got to get real food in there and not do this kibble where because you're right. The expansion is just, even from a mechanical issue, ignoring the health or lack of nutrition in the processed dog food, just mechanically, that's kind of.
right on, right on. And Naja's asking if it's recommended to give turmeric to a hot dog. And again, small amounts, probably okay.
Yeah.
Large amounts might create a problem because it can be pretty warming. So,
And what I would do
what's
for
your
that hot dog is
Mhm.
do ground turkey as my
Right
whole
on?
food, right? Because I've got a cooling meat. And what I love about turkey is it's our best cooling meat that is available in our grocery store. Like we do the fire diet, and She Dog is our turkey diet. So for that dog, for a hot dog, I would say if there's a benefit of turmeric, add the littlest bit of turmeric to a ground turkey diet. That's, either you cook or you can do the fire diet, but that would be my way to get both.
Right on. That's it. And that's the beautiful thing. You can make so many adaptations based on what your pet needs.
Yeah.
So that's a great question. We've got some really awesome stuff coming in here. So yeah, exactly. It's a balancing act. It's not all one size fits all. You gotta look at A, how your dog is doing, and B, how is it responding to what you're putting in the bowl.
And I think
Um,
how's it's doing the first question with how it's doing for me is always, how is it eating? Is it eating well? And is it feeling good after it eats? And you know what I mean? So start with that and then think, what am I trying to do for my dog's long term? And then add on, but get that base of real food to start off with, a healthy base.
Exactly. And that's kind of the thing. I mean, we tend to, in the US, we tend to go in this whole path of this is the way. No, this is the way. No, this is the way. And the reason there's so many different ways is because the one way doesn't work for every person or every dog or every cat. So
Or even
I
in
agree
every part of
totally.
their life.
Yeah, exactly. What may not work at 10, but that's
Yeah.
exactly it. So if you're
That's what I
noticing
think a
2
lot
hours
about with.
later they're licking lips and stuff, I mean, that's not cool.
Yeah. What I think a
Sorry.
lot about is with the raw food, Chinese medicine, I'm sure sees raw food as good for some who are very healthy and strong, strong chi, right? Because you're going to cook it. But senior or youngster, anybody who's a little deficient, then we might want to go to cooked, and that's just a way to feed more gently, is to feed cooked. So that's kind of an example of different phases of your life. You know what I mean? That you may eat differently, just like us.
Exactly, exactly. And so I think you just got to pay attention to what your dog or your cat's telling you. And Lisa, I mean, you got a hot mess going on there, and that
Hmm.
is way more than I think either of us can answer in this in this question in this session. But one of the things I would encourage you to do is to do a food sensitivity test right off the rip. And
Hmm.
see what's going on, and then work with somebody that can help you figure out, okay, I've got these sensitivities that my dog's dealing with, and these other things that create some challenges because of the other health challenges you've got going on. And so
Yeah.
that's where Yeah, that's where working
I
with a
mean,
holistic pet health coach is awesome, or a
right.
veterinarian if you've got access. Yeah.
And I would say
And
with
then are
that,
you?
she's feeding
Mhm.
turkey, so you could, and if she's concerned about any change, you could do light change by maybe keeping the turkey in a different form, or, so you could either say, okay, well, I want to balance it a little bit, or I want to alter it a little bit, but still keep, like you could do, like our fire diet is turkey, or if she wants to try a different protein, depending on, again, I probably, you're right, with help from a veterinarian, help from a pet health coach. But maybe even pork is another protein that I'll consider sometimes for GI sensitive dogs if I can't use turkey. Because I agree with her. I like turkey as my first choice.
Right on, right on. And sometimes you just, again, we've had so many pets recently come up sensitive to almost every protein. And so
Yeah,
I even had to create a vegan diet, which is going to raise
that's hard.
shudders and scariness. Uh, if that's what it takes to kind of clear the decks and then be able to start to add things back in later, then that's kind
That
of an
sounds like,
option.
yeah, I made our earth diet is similar to what you, so our earth diet is our only vegetarian diet. Not that we're trying to make dogs vegetarian, but it's a tofu and egg based diet. So it's mostly egg
Right
for
on.
just what you're thinking of, damp draining, and it has mushrooms in it, and it has, so we're trying to kind of, drain out. We use it for a lot of anti-cancer properties, try to drain out toxins. But I love to couple that earth diet with maybe a meat diet. So then we'll have a client do like a custom combination of earth and metal, like our beef diet, or maybe just cook in some ground beef so that you kind of get a little bit of balance there, but still get those damp draining properties.
Right on. And you guys have some awesome questions today. So Dolores is asking, is meat better raw or cooked? And
Good question.
yeah,
Yeah, I would say
and I'm going to
cooked is
tell
more
you,
gentle. So go
yeah,
ahead.
I agree. And if I'm right there with you. If your dog has got GI issues or has existing health issues, to me that means leaky gut or intestinal permeability is already present. And if we think about the spleen, the main digestive organ in traditional Chinese veterinary medicine, it abhors cold and damp. So if we're throwing raw meat, that's cold and damp in there, even if it's a hot protein. So
Right.
to me, especially if your pet's got some issues, it's better to go cooked. Now, is that right for every single patient? Again, no. Look at your dog, look at your cat. What are they telling you? Do they feel good after they've eaten? And yeah, and organs and that kind of stuff, I would definitely cook as well, because unfortunately, they do a lot of the filtering for us. Cool.
Absolutely.
So we're talking a lot about the five elements, sort of inadvertently, but we've alluded to the spleen a couple of times as being the main digestive organ. So how do you, and you've got an earth diet, so spleen is the element of the earth, but talk about why that is so important, why the spleen really plays a main role.
Yeah, well, I mean, I'm sure the spleen is in Chinese medicine, meaning not specifically the actual spleen. It's kind of the metaphorical way we describe the middle part of our body, our digestion. So it's really more like our pancreas and our stomach and some functions of the liver kind of combined. But we think of it as, kind of the way in which we digest our food, and how healthy is our spleen means how well we are digesting and some other things. It also affects our skin, the dog's coat. But big picture is when we think about, and this is what for me was so impactful when it comes to looking at food and food therapy, is when in Chinese medicine, we call, when you're born, we say you have a certain amount of gene, right? Which is almost like your genes, right? The Western medicine, we say you have your genes. And if you have a dog who, lives till they're 18 and they're super healthy and they've just been eating kibble or whatever, and they just then that dog has great genes or great jing, and God bless them, right? When we have a dog who's weak or deficient or just always struggles, that dog is weak gene, or we'll just go, darn it, they got the bad genes. It's just another way to describe it. But the only way you have of improving your jing or improving your health in Chinese medicine is to improve your digestion, because that's the only source of what we call postnatal jing. So basically it says, it's just a way of kind of describing what we already know, which is to be healthy, you should eat well, right? And in Chinese medicine, we say to be healthy, the only way you can improve your jing is to strengthen your spleen qi. So you do that with food. So to me, that was like kind of game changer, especially when I'm sure like you see lots of dogs who have health needs. We don't see the healthy ones. We see the dogs who are struggling. And so for those dogs, it was just like, man, how can we give more to this dog? We have a client who wants to do everything, right? And a vet who's willing to do everything. And how can we bring more to this dog? It was always food.
Exactly, exactly. And I think that's just critical. And the thing that was so interesting to me, I studied functional medicine after traditional Chinese veterinary medicine, but it's another system of medicine where digestion is the main role. So I used to, my favorite saying is that you can't outpill a bad diet or the wrong
Mm-hmm.
diet for your dog. And I think that's probably a more appropriate response, because as we've been saying, what works for one dog may not work for another dog. But to me, in my hands, cooked food has worked, I would say, 95% of the time.
Yeah,
And
I think it's the only
you
way. And
find,
especially if our dogs were already eating real food, then we wouldn't have, we wouldn't be, sort of shouting from the rooftops about how important food is, because they'd already be on a healthy diet. It's just that so many of our patients and so many, dog owners have experiences with dogs who've been on kibble, which is by definition processed and therefore pro-inflammatory. So that's why it's such a significant part to change the food if they've been eating processed food.
Amen. Amen. And, Dolores, and sort of an answer to your question, the other part of what happens when the spleen is working well is it produces gu qi or food qi. The gu qi goes up to the lungs and moistens the lungs, gives it energy there, and then further gets transformed into wei qi, which is like this protective umbrella. So it's kind of like the immune system. So if you're eating well, your immune function is going to be well. So that's kind of how this all ties together. It's a very elegant system once you kind of dig into it, but it's really kind of mind-boggling to start with.
Yeah.
So I hope that's helpful too. So it's, and that's the thing. I mean, what's really important is, like Naja is saying, that rabbit was a game changer for her dog Tonka, and that's an extremely cooling protein. But that was what he needed to get right. You just have to keep trying and looking and seeing, is this working? Is this better? Or is the same? And keep moving forward from there. So there's a lot of folks out there that are talking about raw, and that's sort of most of our colleagues are in the raw way. And that's what they have found to be successful. But it's interesting. I was doing some research on the oldest dogs, and there was a woman that had actually compiled what the oldest dogs were eating. And what the really interesting thing is that the vast majority of them were eating kibble. So out of 30 dogs, 15 were eating kibble, 2 ate raw, and the rest were eating home cooked. I think there were 5 of them that they weren't quite sure. But what was really cool was that, and one dog was from South Carolina and was eating like hot dogs and hamburgers. And I mean, like just Doritos, really bad food. And this dog lived to be 31, but he'd never been neutered. So I think that's there's so many factors. We can't just say it's the food, it's the vaccines, it's the Bravecto, it's it's the whole picture altogether. So we have to really be cognizant of all the other factors that may be going on in that dog's life.
And for your individual dog, you just have to think, how can I make my dog? You know what I mean? Because I can't change the air they breathe, right? I can't change. There's some things you can't change, but you can change a lot of. So we just know the principles of things that are most likely to encourage health, good food, clean environment, less pesticides, and, and that's you do the best you can.
Exactly. And this is extremely true, Naja. You have to be patient, because your dog didn't develop these horrible skin issues in 2 weeks, and they're not going to go away in 2 weeks either. It may be patient, expect small gradual changes. Maybe it'll take 3 months. Maybe you'll really get lucky and it really is 3 weeks, but you just have to be patient. So, and Lisa, you got a lot of stuff going on. Again, this is where you've got to really work with somebody that can walk you through this. If your dog has protein losing enteropathy and is on a really strong medication like budesonide, again, this is a situation that didn't happen last month. This has probably been going on for months or years. And so you need to be patient. You need to work with somebody that can really help you be guided through this process. And you want the coaches, and because I've trained them to know all the stuff, to how to work with Chinese medicine. And then Dr. Borer can help you if you don't have time to cook. She's got all the good stuff for you,
Yeah,
set up
absolutely.
with the diets. Yeah. So, but this is a diagnosis I learned about in veterinary school, right? Protein losing enteropathy. And I think I saw one case. And then probably about
Wow.
2005, we started seeing them all the time.
Wow.
So I finished
Oh,
school
wow.
in 1990 for frame of reference. But I mean, was that your experience too? It's like
Oh, yeah.
all
There,
these things
and
we heard about.
And other, I find that, and I don't know if we're better at finding it, right? Or if we're just more in tune to it, or if we really do have a lot of changes, but it is definitely pointing to GI issues, to have a protein losing enteropathy. So losing protein through your intestines. And the other thing, I mean, but there are a lot of conditions, gallbladder stones, that I think I saw as an intern, and we thought this is the only time you'll ever see this case. And now we hear about, gallbladder stones a lot. And those are another chronic Western medicine condition that points directly to diet. In Chinese medicine, you get things like stones and tumors when things stagnate. And they stagnate, when we've got a weak spleen qi, we've got a weak wei qi. So our digestion, our immune system doesn't move things, and then as it should, and then we end up getting stuck. And when it gets stuck, it promotes heat, and then it gets more stuck. And next thing you know, we've got tumors and stones and that kind of stuff. So again, it comes back to prevention with good food, with a healthy environment. But you're right. Where I think it's even when it comes to nutritional issues, like that we see intermittently in Western veterinary nutrition. Chinese medicine says you start with a poor quality diet, you're going to get deficiencies, you're going to get chronic imbalances, and whether it's protein losing enteropathy or gallbladder stones, or when we have urinary bladder stones, it's just going to be, you're chasing things, right, always. And that was the frustrating thing to me, at least in Western medicine, is let's if we can start with better health, and initially we'll chase less chronic disease.
Right on. And that's the thing. I mean, that's where Western medicine is amazing. Like, if you've got appendicitis, hospital is the best place to be in. I can guarantee you that was not fun, but that's what needed to happen, right?
Yeah.
Same thing. If your dog is injured, it has a laceration, it needs to be sewn up. Where Western medicine really, really fails is chronic disease, because we're
that's what I love,
accustomed,
the
we're trained
integrative
to
approach.
treat symptoms. Yeah. Right.
And then that way,
Exactly.
use the Western medicine, but we know that if it fixed everything, we'd be done. So then we add on and use Chinese medicine to integrate the two.
Right on, right on. So we talked briefly about skin disease. And so in functional medicine, I can tell you, any type of dermatitis is an offshoot of intestinal permeability or leaky gut syndrome. And I think it's the path to that understanding gets a little less clear with traditional Chinese medicine. But I mean, I've heard you say, GI disease, skin disease, and those are your top two, I'm guessing. So
yeah.
So when you see that patient come to you, or that person that has a dog or a cat with skin issues, how do you help them sort that through with food?
Yeah, I mean, usually I'm sure, in Western medicine, we think, well, is it because Western medicine puts it into two distinct categories? You're either food allergic, less common, or it's environmental allergies, the pollen allergies. And then if Western medicine says, well, if it's a pollen allergy, then the food doesn't matter. Eat whatever you want. It's completely irrelevant, right? Which, Chinese medicine knows that that's not true. And there is some research now, I'm sure in Western medicine, that's starting to show, they talk about, the gut-skin axis, they talk about the microbiome and how, oh my gosh, it does affect the skin. So there is, which I love, because, Chinese medicine's like, well, we knew that long time ago.
You mean it's yeah, you mean it's all related?
Yeah, exactly. So we should take a holistic approach. But no, so Western medicine puts them in two discrete boxes. That so commonly clients will come to me, or I'll, to speak with clients who say, I don't know if my dog has a food allergy, or it's usually they might, so let's not ignore that. And so what we'll usually do is we'll start them on like our water diet, which is pork, or they can cook ground pork. Pork is usually a novel. So we talk about novel protein. So Western medicine says, if you have a food, you want a new protein. And so of the new proteins, we think pork is most likely going to be one that you haven't seen before. And that's kind of the extent of the reasoning behind that. But Chinese, so I like to use pork as it's a neutral meat from a Chinese medicine perspective, but I like that specific protein because then it'll still fit the box of the Western medicine. Let's do something novel as a novel protein diet, but I still get a whole food and one that's here in the US. Right. So I want a USDA regulated, made here in the US, produced here in the US. I don't want to have to get any ingredients from outside of the US. So that's why that's my talk. So we use the water diet for a lot of allergies, skin issues. If we know this dog is really not a food allergy dog, then I like to use the turkey as a cooling protein. So we'll use fire diet. That's kind of my other big one. I do have some dogs who are doing great on beef, right? So not every dog is going to be exactly the same, but just as a general rule, I'm sure if you have a skin dog, get that dog off processed food, because that is going to be your biggest game changer. And then which one should I try? If I'm getting off processed food, which one should I try? Probably pork.
Right on. And that's it. And but it's amazing. There are dogs that when we're doing the food sensitivity testings, they come out fine for chicken because they've never eaten chicken in their lives. So it just really, it just depends.
Yeah,
but I think that's, and I think it's an important distinction to make. Like you said, food allergies, truly less than 5% of any of the skin conditions are true food allergies. But I would wager that the majority of them have some level of food sensitivities, meaning that because of the leaky gut, they're, inappropriately digested molecules of the protein are getting into the lymphatic system. And so if we just clean the decks, take everything away that's irritating, we can reintroduce many of those foods later, and the dog or the cat's perfect, or the person is perfectly fine with them. But,
no, that's a good point, especially because rotation is beneficial. Like we talk about eat the rainbow, right? Like we know that our own diet, rotation is beneficial. Same is true for our dogs. Unless you have like some of these dogs we're seeing on the chat, dogs who are very sensitive, well, that's a GI issues. So I kind of say rotation is something that we hope to build to. If we have a dog with GI issues, we start with limited. And then as their gut gets healthier, as their microbiome gets stronger, then hopefully we're able to branch out to eventually get them to rotate. So that's and then hopefully, or if you have a young, healthy dog that you want them just to stay young and healthy, that's the perfect rotation diet, then send him a couple different proteins and that's great.
Exactly. And Dolores is asking about veggies. And I think those are incredibly important. But again, like for Lisa's little dog that's got PLE, adding in a bunch of vegetables at one go would be disastrous because her gut is just not able to handle it.
Yes, and not raw, right? We would want to cook gentle.
Well, no, absolutely. Well, I would personally, I'm down for slow cooking because we're presenting everything in a pre-digested format, and because these guys are often so sick, that's kind of all we can handle. So I think it's it's important. And again,
especially
this is
because
where
I do hear a lot. Go ahead.
Yeah, exactly. Please.
I do hear a lot of clients who say, I have a dog with GI issues. And so they're thinking to help their GI issues, they're going to give them more, because we think what's healthy? Vegetables. So giving them more vegetables to try to help them can actually be counterintuitive, because what you want to focus on is just cooked and gentle, which is meat, carbs, right? Cooked and gentle. And then a little bit of cooked vegetables is good, as long as it's just a little. And then, but you don't want to be giving a dog with GI issues lots of carrots and raw carrots and raw green beans all day, because that could be too much roughage for their stomach.
Exactly. And that's it. If you've got a massive dysbiosis going on in there, you throw in disaster pants. Exactly, Lisa. You throw in a bunch of raw vegetables, and it's an unhappy next several hours. So that's that's it. I would when with one of our starter diets is literally just a protein, a small amount of butternut squash, a small amount of kale, and a small amount of a healthy fat, just to kind of get the gut able to tolerate things, and then we gradually add other ingredients in.
Yeah.
to based on what that dog can handle. Right on. So any tips you can think of that for people they've been feeding kibble? I think all of y'all are probably not feeding kibble, but that seems to be the hardest switch, is from kibble to some sort of real food. So what are the tips you typically recommend?
I definitely say, well, if you have a dog who you want to try it, easiest thing is to grab the eggs in your fridge and scramble an egg, right? And owners are always asking me, well, what kind of oil? Can I use butter? Like, how do I scramble an egg? It's kind of like we forget, how to do food when it comes to our dogs. So it's, whatever you normally cook it, a little olive oil, a little butter, whatever, that's fine. Just go ahead and cook a little bit. And because usually it's something you already have in your fridge, right? So scrambled eggs can be great. If you have a really picky dog or a senior dog, and so you really want to get some of that nice, healthy, natural fat, ground beef is one of my favorites. I'll say, let's, go ahead, and because I have a lot of clients, if they come to me and say, well, I ordered your metal diet, your beef diet, and I really want to get started tonight. How can I, I'll say, well, grab some ground beef and start to, cook it in the skillet, little olive oil or butter, whatever you usually use, and then start to top a little bit to your food and just kind of try to add that. And I really encourage owners to start there, because I'll say our diets are all ground meat. So we do just the same ground meat that, you and I get at the grocery store. And so we use that as our base, and with that and a little bit of carb. So we do low carb, like 10% carb. We don't like a lot, but a little. And then a little bit of cooked vegetables. So basically our recipes, our whole food ingredients are on our website, and any of those whole foods you can kind of test out and cook a little bit with your dog. And then just to kind of get some real food in their bodies. Because I'm sure, if you've got, two 150-pound, great schnauzers or something, you could always, add a lot. If owner says, I have a 90-pound Rottweiler, but I really want to get them on something healthy. We'll say, order for a 45-pound dog. And now you've got half their food, right? You've got half of it balanced.
Right on.
You've got half, and then you could cook a little bit or do a little kibble, that way you really have some flexibility there, just to kind of do what works for your dog and what works for your, your household and your schedule and all that kind of stuff.
Exactly. Because that's the other big thing too. It's like we have all these intentions to do the right thing, but the reality is that if we've only got 30 minutes of time to ourselves at the end of the day, the last thing we want to add into that 30 minutes is making the batch of food for the next 5 days, right?
Yeah.
So do what you think you can do consistently. So, if your dog's pretty healthy and you're feeding kibble, go get a bag of Normandy blend vegetables, take a small handful, boil them in water, cook them really well, chop them up a little bit, throw them and the water on top of the kibble, and that's a good start. You're still improving what's in your dog's bowl dramatically.
Yeah, and it's very, I find that the more you are able to give them real food, just you see the benefit both in health-wise and then also just from them emotionally. You know what I mean? We'll see, I'm sure you've had experiences where, we'll have the dog who's the owner switches to, to real food, and it's, oh my gosh, that anxiety improved. Could you believe that they're sleeping better? You know what I mean? So those kinds of just sort of general well-being things are, and that kind of encourages us to keep moving with it. It's sort of, you get the immediate kind of benefit there.
Yeah, absolutely. And we know, on the functional side or the physiologic side, that the gut is responsible for something like 75% of immune system function and almost 90% of our neurotransmitter function. So it's no wonder that they're less anxious, that they're sleeping better. So
there's studies in people that show, they're showing processed food connection is related to depression. Right. And so just that connection of the brain and the gut, right? It happens in our dogs too. They're mammals.
Yeah,
and our cats.
Exactly. Like Hayo came out of a situation where this woman had 140 dogs in her house, and just awful. So her anxiety level was astronomical. She had her right front leg was broken. I can't even begin to think of what had been going on there for her. But when my mom got her and started giving her real food, this dog was like, really? That's for me? Yeah. And she was like, oh. and the poor thing, this is the last dog I did surgery on. I had to spay her and take out all of her teeth. Her mouth was that bad. So I think that was one of the first times in her life it didn't hurt to eat too. So
Right.
I mean, it's just astonishing. But
Right. How much
I think we
inflammation can
don't
be in one body.
exactly. I mean, it's just crazy. Well,
Yeah.
one of the things that I wanted to share with folks is your website. And let me see if I'm
Oh, yeah.
smart enough to do that. But you've got a really cool site, really detailed as far as the information goes. Um, how basically the concepts behind the diets that you've produced, and you're able to get the diet formulated and delivered straight to the pet parent's home. And that, I
Yeah.
mean, I think that's great.
Because I mean, I did this because I did recipes, home cooking recipes for my clients for years. And my recipes, as I went, they got simpler, you know what I mean? And they got easier. And then at the same time, it was also like, this for some clients, it was like you'd see the benefit in the dog when they're home cooking, but it'd be hard to always do it. Right. So it was kind of that commitment. It was like, and I kind of didn't want to always be trying to retrofit another company's food and to get the Chinese medicine pattern. You know what I mean? So like
Right
if you go
on.
to the top and hit diet plans, it'll show what specific conditions, for example. So we try to translate it to Western medicine. So if we have a
Right on.
pancreatitis, we're going to recommend lean protein. You know what I mean? We're going to recommend the turkey diet. If they have, like for example, the wood diet is going to be for GI sensitivity. That's our gentle chi tonic, right? So we try to
Right
put
on.
the Western medicine conditions. So even if you want to just see, go, well, my dog has inflammatory bowel disease, well, then you can look at the water diet and look at the ingredients and just kind of have an idea of proteins and foods that will benefit from a holistic perspective. We just tried to sort of use it. They could, use it either way. And so we've got lots of blogs that really talk about, case by let's talk about skin. Let's talk about liver. Let's talk about cancer. You know what I mean? So I try to sort of go through. And, so it can be a lot of information, but we try to sort of go through and give a place where people can find, some information about their dog's specific condition from a food therapy perspective and, just kind of get some more knowledge. Cause I find a lot of times when it comes to feeding your dog, there could be a lot of, it can be scary, especially if your dog isn't doing well or you've got to, it can be a lot.
It is a lot. And that's kind of, we were chatting before we went on. When I started talking about home cooking in 2006 and 2007, just as the pet food recall hit, I was scared to death. It was like the AFCO police were going to come get me. And I think you had that same, like, what am I supposed to do?
Right. Yeah,
So
absolutely. And
that's
really for us, finding a nutritionist who saw the benefit of whole foods helped us because then we were able to balance it. But over time,
right.
our nutritionist will say if that client is feeding half balanced diet, so we'll do a lot of 90-pound dog orders for 45 pounds of dog of Chi Dog, that gives them a balanced base, and then they can home cook, like maybe doing your crock pot or something. They can home cook all kinds of stuff on top of it and not have to balance that because they've got a balanced base. Half of your diet is balanced, and that's what you need to have a balanced diet.
Right on. And Judy's asking a great question, Honest Kitchen or one of the other dehydrated foods. I think that if your next option is Kibble, this is a good option, but
Yeah,
it's
absolutely.
still more processed. And so that's kind of the thing. The less processed the food is going into your bowl, the better things are. So I think that's really critical.
Yeah, the moment we can get to a whole food, you can identify what it is. You can see it, and know what it is. And the only thing I add is when you have little dogs, small pieces, little mouths, small pieces, which
Right
I'm
on.
sure you already get that with your crock pot. You've already made it so gentle.
Exactly. And so, you can make it into a puree. And I mean, that's the bizarre thing. Like this, she has her two little canine teeth. She doesn't want a puree. She wants chunky food. Go figure.
Yeah. I always say it's better to chew on healthy gum than painful tooth, right?
Yeah, exactly. Yeah. And that's precisely the thing. So one of the other things you've got is an ebook, and we'll drop the link here in just a second into the chat here. But what is this book you've got?
So it's basically a compilation of a lot of our blogs and a lot of our kind of in-depth, sort of looking at individual conditions, so that I don't expect a dog owner to go and read the whole thing, but look, you could use it as a, if I have a skin dog, I might want to read the skin chapter. You know, if I have a liver dog who's dealing with liver disease, I might want to see what does traditional Chinese medicine say about liver disease and how do we support the liver, you know, with this. So we do a lot on cancer prevention, you know, cancer when dogs are on chemo, like for example, when they're on chemo, we're going to say, or they're weak, right? They're dealing with they feel it. Then we're going to say, feed that dog beef oftentimes. What a great blood builder, you know, strength, you know. Right. And if the dog is doing great, we want to prevent cancer. We might say add in some earth diet. So that, or some egg and tofu, you know, with some mushrooms. So we have kind of some different thoughts about how to use food for different conditions in that ebook.
That's awesome. And I'm noticing too, I think I don't see a place to drop a person's email, but here's the support email. So you can just, was that cool?
Yeah, I don't know if it didn't. I don't know how it's missing that one spot. It should be sent over. But if it's not on your, I'll resend it.
Yeah, let me just double check
my
email and make sure I didn't do something stupid.
That's okay.
Let's see. Right.
Yeah, it shows up on mine. It's weird.
That's strange. Yeah.
I'll re-email it to you as well.
Yeah, no, I checked it from the email. So yeah, re-email it and I'll see if I can send that over.
I see on my end, it says hit your email here, but you're right. You can always go to support@chiog.com and say, send me ebook.
Right on. But yeah, I mean, you can just all the folks what you guys are dealing with. So, you know, if you did Janet, if you did a Glacier Peaks test 5 years ago, I would, I mean, honestly, this is where you need somebody to help you walk through this. So you may need to repeat that test. We're actually looking at a couple of different options for food sensitivity testing. And again, work with a health coach. I just can't recommend that strongly enough because they know how to use these tests and also how to manipulate the diet, help you figure out how to heal and seal the gut.
And maybe even just do beef or pork. Start with, you know what I mean? So she's doing beef and pork loin, maybe go,
separate them out.
Or just beef and try, and then try one of those two to see if that changes things.
Yeah, that's an excellent suggestion because sometimes by having things put together, it's really confusing. Yeah. So that would
be a case where, you want to limit things and go, okay, as long as the dog's eating, because we always say we can all make the perfect Chinese medicine diet, but if the dog doesn't eat it, then you need to find something else. And then that kind of gets into sometimes we have to rotate by necessity.
Exactly. Yeah. Because and that's the beauty of having a single protein diet is it's crystal clear if that's okay or not okay. And I think that's really important. Dr. Bora, thank you so much for taking time to jump in with us today. Any parting words of wisdom you want to pass on to folks?
Oh, just
that's always a tough one.
No, if you have a couple of minutes, I would say go to your fridge, grab something real, put it in your dog's food, and start there. And if you're already well into whole foods and you're already doing that, then maybe our ebook food therapy book can help give you some more insight into how to sort of go further for your dog to help support them.
Right on. Again, thank you so much. Thanks everybody for jumping on today. You had wonderful questions and you see the problem. It's not all cut and dried, sadly, but this is a good place to start if you haven't even begun digging in. So until next time, thank you so much. Keep the questions coming on our pages and we will look forward to answering more for you. Thanks so much. Cheers.
Thank you.
And I'll